person who has diabetes and has pain and burning in the soles of their feet, they are told that they have diabetic neuropathy. When a person who does not have diabetes has the same symptoms, it is called idiopathic neuropathy. Idiopathic is the term used when they don't know the cause of a condition. In actuality, both these conditions have the same cause, and diabetes is not the cause of either one. I think that it is important for people to be aware that for the most part, doctors are not trained to look for the causation of illness. They are trained to treat symptoms with medications. Now, without the knowledge of the cause of an illness, it is difficult to achieve a cure. However, there is actually one major exception to what I'm saying. When it comes to infectious disease, doctors have been trained to order certain tests to determine the causative organism. And as a result, drugs such as antibiotics are the only drugs that are known to cure anything. Almost all other medications are Band-Aids that treat but do not cure. It is obvious from this small example that if doctors were taught what causes various illnesses, it would provide a revolutionary approach to dealing with illness. So it is important for those of you watching my videos about treating the cause of various conditions that these are my own ideas, but they're not backed by evidence-based medicine that doctors put a lot of faith in. Instead, my ideas are backed by observational-based medicine, which is actually how medicine progressed for the first 600 years. And so, getting back to the cause of neuropathy in the feet, it is my contention that is caused by the continuous release of excess adrenaline. Many people are aware that adrenaline is a survival hormone and is known as the fight or flight hormone. Part of its job with regard to survival is that adrenaline cuts off circulation to areas of the body that are not needed for survival. Now, in the old days, adrenaline was released only for a short period of time until the danger passed. However, nowadays, there are people who are releasing adrenaline all day and all night, but they're not in danger. As a result of this release of adrenaline, the microcirculation in the feet becomes severely compromised, and the nerves in the feet become damaged, basically because of the cutoff of oxygen and nutrients that are needed for the maintenance of the nerves. At the same time, the person with neuropathy in the feet will always experience coldness in the feet and often the hands as well. Understandably, the primary treatment of this condition should involve the lowering of adrenaline levels. Information about this can be obtained from my book called Adrenaline Dominance. Part of the treatment also involves the application of a 5% progesterone cream to the feet. And this is the exact strength needed to block adrenaline. What's nice is that progesterone cream also blocks insulin, which is another hormone that can cause nerve damage. And progesterone is also the strongest stimulant to the production of myelin, the substance that allows nerves to communicate with one another. So one can readily see that, the treatment of neuropathy in the feet can benefit immensely from the use of a 5% progesterone cream and the lowering of adrenaline.